What about when it comes to the vaccine, Emma? What effect will a no-deal Brexit have on the UK's access to the vaccine?
Well, that's a very interesting question, and it's one that a number of people have been asking over the weekend as we saw these Brexit talks take a bit of a turn for the worse. As you mentioned in your introduction there, the first shots of the vaccine in the UK due to be administered tomorrow. The government here saying that a no-deal Brexit will not impact supplies of the vaccine. They say they are prepared for every eventuality. Government minister today speaking on British television saying that they're looking at all potential options, also potentially looking at the use of non-commercial flights to make sure that the vaccine gets to the UK, and for that read perhaps using the armed forces. They didn't say that explicitly though, and of course this all a concern because one of the big issues with the Brexit deal is if you get to a no-deal Brexit, what does that mean for customs, goods leaving the UK and goods coming into the UK from Europe? And there's been a lot of concern that that could create big customs queues, and the last thing you want is a vaccine that needs to be stored at minus 70 degrees centigrade to be stuck in a big customs queue trying to get into the country. Yeah,
that's a really important thing to think about. I'm wondering how the medical regulator in the UK has prepared a plan for a possible different Brexit outcomes. What are they saying?
Exactly. The medical regulator speaking over the weekend, the CEO there saying that, again, they are prepared for all eventualities. It isn't something that should be concerning to the British public. They say they're ready for any form of Brexit deal. We don't know what those contingency plans are from them, but they seem to be quite confident that they would still be able to make sure that the vaccine gets to the UK should we see a no-deal Brexit.
What have you heard just living there in terms of when you're actually going to be able to get access to the vaccine? I mean, it's huge news that the first shots could be tomorrow in the UK, but what does it mean for someone in your position and for our colleagues and people on the ground there?
Well, I think I'm pretty far down the queue because the vaccine will be given according to a priority list. So we know that some doses of the vaccine are already in the UK. They came over from Belgium. They're being held in a secure location and where they're being quality tested to make sure that no batches were spoiled during transport. They will be administered, the first shots tomorrow, starting really in hospitals. They'll be administered by doctors. And we know that the first people to get those vaccines are those who are residents of care homes, the staff there, then some NHS staff and the elderly, those who are over 80 years old. For me personally, I'm pretty far down that queue, I would imagine, but it is a very good thing to know that those who are the most vulnerable in society are the ones that will be getting the vaccine first. And of course, if the most vulnerable get the vaccine first, that could help things return to a greater sense of normality going forward. Of course, we know that we're still a few months away from that.
What is the timeline, though, for the full vaccination of the country? I mean, here in the U.S., we heard from Health and Human Services over the weekend that it will be mid-2021 until people who are pretty far down on the list, myself included, will have access to that vaccine. Is it a similar timeline in London, Emma, and in the UK?
It is a very similar timeline in the UK. They're starting through these priority lists. I guess in the UK you could say we've got a bit of a head start given that the Pfizer-BioNTech vaccine has already been approved and that, that the vaccine is already about to be administered. But I think for a lot of people and for the majority of the population, it will be further down the line. And of course, this is just one of the vaccines that's out there, the first one to be approved in the UK, but also one that is more difficult to administer. I mentioned, of course, the way it has to be stored at minus 70 degrees Celsius. You also require 2 shots of it. And so I think to get everybody in a country to reach herd immunity, which is about 80%, that will take some time. I think the hope is, of course, that some of the other vaccines that have been developed will also get approval so that you'll get a mix of vaccines being used, and that could perhaps speed the process up. But again, a number of different reports saying it will be later in the year for everybody, and we're looking at back to normality Q2, Q3.
And we're also learning that Queen Elizabeth and Prince Philip will be some of the first people to actually get the vaccine. Why is that?
You're absolutely right. There were reports in some of the more tabloid newspapers over the weekend talking about when the Queen and her husband, Prince Philip, will get the vaccine. Some of those reporting that they will be given it in order to encourage others to have it. It will help other people, anyone who might have any safety fears or concerns about it. If they see the Queen and Prince Philip getting the vaccine, that might help allay those fears. Of course, remember, the Queen is 94 and Prince Philip is 99, so they really already fall into that top priority category. So I imagine they would get the vaccine based on their age as well.
Emma Chandra in London. Thank you, as always, for your time and for joining us on Quick Take today. It's great to see you.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.